do want to thank the hospital and everybody who cared for me, because I actually have a leg now because of the surgeons.
About a dozen former trauma patients returned to Memorial Regional Hospital for a reunion with their rescuers, doctors, and staffers as part of Trauma Awareness Month. The annual event reunites the hospital's trauma teams as well as EMS representatives from the community with the patients they've treated and their families.
This is our annual reminder of how important the hospital serves, the role that the hospital serves for the community. Obviously, it's easy to give a lot of credit to the doctors, but there's obviously a lot of nurses, therapists. There's a lot of people involved in the whole hospital system that make our patients' survival outcome really well.
She was here 2 months, then she went 1 month to the rehab, and that was hard. She left here on a wheelchair, so thanks to you guys. I'm thankful that you can see what you do, and you don't really hear it much, but thank you. My Mother's Day was extra special because of you guys.
Mr. Tovar represents what a quality trauma program can accomplish, and with all of the right pieces in place, this is the kind of result that we can have when someone tears open their aorta, which is the main blood vessel that comes off of the heart. And that's what happened when you went flying off that motorcycle. You stopped, the aorta tore, and without all of these pieces in place in a hospital like this, he would never be here. He was on a heart-lung machine for several days, where 15, I mean, it's just an incredible story that 20 years ago, 30 years ago would never have happened. But nowadays, with all of the bells and whistles that a modern ICU and a modern operating room can provide, is just an amazing thing.
I just had the right team that same day. I had the heart doctor, Dr. Lee, trauma doctors. I had all the 7 great doctors. Dr. Guru, Donald, shorts for my hand. It was just great overall, and I was just very positive, so that helped me out a lot with all the nurses.